middle. This one superior concha. Okay, inferior, middle, all of this middle. This is superior concha, this small. Okay, clear? Now meatus will be this depression.
Yeah, the depression in
inferior, middle, and superior meatus. Okay, this one. Now go inferior concha, middle concha, superior concha. Okay, this small. Then meatus is a depression below it. This will be inferior meatus, middle meatus, superior meatus. Now go above. Which bone is this? Sphenoid bone, right?
Yeah.
This is all sphenoid. This is the sinus of sphenoid. Okay? Yes.
Where is sphenoid bone?
This, all of this is sphenoid bone.
Okay.
You see this? This is sphenoid bone. Below it is the sinus, sphenoid sinus. Now, you already know superior concha and middle concha are which bone? Ethmoid.
Yeah.
This is ethmoid bone, right? So now if you see this depression here, which is this gap, small gap here, this is called sphenoethmoidal recess, because it's between sphenoid and ethmoid. So we call it sphenoethmoidal recess. It's above the superior concha, right? It's above the superior concha. This is superior concha. Above it you see this small depression. Okay? This is sphenoethmoidal recess. Clear?
Yeah.
Okay? Sphenoethmoidal recess is above the superior concha. Superior meatus is below the superior concha. You get confused here. You usually say superior meatus is here. Superior meatus is below it. Okay? So I will repeat. Inferior concha, middle concha, superior concha. And this is inferior meatus, middle meatus, superior meatus. Sphenoethmoidal recess is between sphenoid bone and ethmoid bone. Okay, so all of this is ethmoid, so we say this space here. Okay, this is recess. Recess means cavity.
Yeah.
The pouch. Okay, so it's like a pouch and we call it sphenoethmoidal recess. Okay, clear? Now, what else? Okay, openings you have to see. In this inferior meatus opens what? Nasolateral duct. Okay. In the middle meatus, if I reflect it like this. Okay. Okay, I have reflected. Do you see this elevation here?
Yeah.
This is called ethmoidal bulla.
Again?
This elevation here, under the middle concha, you have this elevation. Can you see it? This elevation? This is called ethmoidal bulla. Yes, bulla ethmoidalis or ethmoidal bulla.
Yeah.
Okay. Now in this you have this opening. This opening is for middle ethmoidal sinus. Because ethmoidal bulla is because of middle ethmoidal sinus, and the opening is just here. You can see the opening. Okay, that's it about the larynx, which is in the body, which is in this. Now other things we can ask you on the module about the larynx.
What's in the model?
Cartilage.
Yeah.
Okay, muscle, little bit muscle which is posterior, cricoarytenoid, okay, cricothyroid, we can ask you there, and nerves we will ask you in the body. If we ask the nerves of the larynx, that's in the body. Okay? You want to go through this diaphragm?
Yes.
Can you raise this? Thyroid. Okay? See, this is thyroid cartilage. Okay? On this you have one muscle, only one muscle, which is called cricothyroid. To the cricothyroid, the nerve which is going, so look how thin it is. This is external laryngeal. So always external laryngeal is a thin nerve which is going to the cricothyroid. Okay? So cricothyroid is supplied just by this nerve which is external laryngeal. Internal laryngeal is the nerve which will go to the, you see this nerve? Internal laryngeal, okay? Just wait. Internal laryngeal, you know which membrane is here? Between the thyroid and hyoid? Thyrohyoid membrane. It's pierced by internal laryngeal nerve and vessels. Superior laryngeal vessels and internal laryngeal nerve. So internal laryngeal nerve will be above the thyroid, external laryngeal will go to the cricothyroid. So it's like this. It's thin because it is just supplying one nerve. Okay? So it's like this. Internal laryngeal will be thick and it will be going above. External laryngeal will be going down. Okay? So two nerves you will see here. Now there is one more nerve which is recurrent laryngeal nerve. Recurrent laryngeal nerve. In this you can't see because there should be trachea also. Then you will be sure. In this trachea is cut here. Okay, between trachea and esophagus, one nerve. Yes. Between the, because in this it's not clear. Okay, here it is on this side. On this side. You see this is vagus, right? This is vagus. Do you see this nerve coming from vagus? This is the recurrent laryngeal nerve. It will, because on the right side it arises in the neck. It will go like this and then ascend up. Can you see it going up?
Yeah.
This is the recurrent laryngeal nerve. It will be going to the larynx. Okay? So recurrent laryngeal nerve of the right side. On the left side it will arise in the thorax, below the arch of aorta, and then go up. So for recurrent laryngeal, go down. Okay, see it below the larynx, and superior, this external and internal will be above the thyroid. Okay, so you have to know the location. This is all of this. This is recurrent, which is coming out now. Okay, and it's coming out, going, yes, it's right vagus on this side. It will be going down to the stomach and all of that. But here in the neck, it gives recurrent laryngeal nerve, which goes up and ascends to the larynx. Okay. Phrenic is not in this cut. It will be going to the phrenic will be going to the diaphragm. Okay, in this section. Left recurrent you can't see here because it's removed. Left vagus you can't see. This is right vagus, right? This is right vagus like this. It's going down. See, it's going down. But here it is one branch.
Laryngeal.
Yes, recurrent laryngeal, which will be going down, up. It goes up into the larynx. Nerves here. External, yes. On this side it's external cut. See on this side now, you will see this is thyroid gland, okay? Under it you have thyroid cartilage. On this you have a muscle which is called cricothyroid muscle. Now we should look for the nerve which is supplying the cricothyroid. This small. This is external laryngeal. Okay? So external laryngeal you will find here. You go up now above the thyroid, you have a membrane here which is called thyrohyoid membrane. It's pierced by one nerve which is the internal laryngeal nerve. Let me show you. Internal laryngeal will be above, external laryngeal will be here. Clear?
What is the internal? What is the external?
External is with the cricothyroid. Thin one is the external. Thick one is the internal laryngeal. It will enter here and then supply the mucosa above it.
And artery.
Artery will also be here. I can't separate it from it, which is the artery end, because in this is all. Because I have to trace it then. Okay, it's not. You should remember now in this internal laryngeal, the structure which will go with it will be the superior laryngeal vessels, artery, I mean. Okay, with this external laryngeal is here. With this is the superior thyroid artery. Superior thyroid artery is here and external laryngeal. You don't remember this, okay? Leave it. Just remember external laryngeal and internal laryngeal this time, okay? External laryngeal, internal laryngeal, you should know where to find it. Okay? That's it about the...
Doctor.
Yes. Laryngeal? That will be arising from the thorax. It's not present here. Yes, it goes up, back, like the same on this side. Same. Pattern is same. It will go like this and enter the larynx. Same thing on this. Okay. For that, you should always look below the larynx, between the esophagus and this trachea. It goes here. Okay. Just I will dissect it a little bit.
ولا ب10 لا كذا عيب
See it on this one. In the right lung will be the right atrium. Okay, right atrium. Above the right atrium will be superior vena cava. Below will be inferior vena cava. So inferior vena cava here, superior vena cava here. Okay, right atrium here. Above the hilum will be azygos, arch of azygos, because azygos comes like this and drains into here. Okay, into superior vena cava. Behind will be the esophagus. Okay, esophagus here. In exam we can put impression in this mark here, but is a structure related to this. So you have to write esophagus for the right and left lung different.
Between esophagus and esophagus.
Between
Esophagus and esophagus.
esophagus will be here, all of it. Esophagus is just above. Just above the hyoid. Okay, esophagus is just here. Esophagus is all of it. Then superior vena cava is in front, inferior vena cava here, right atrium.
And ascending aorta.
No, this is right lung. In the left. Ascending aorta will be in the left lung. Okay. Now this impression is for the first rib.
What?
This impression for the first rib, because above the first rib is the cervical part of the lung. Okay, apex of the lung. First rib. Okay, here. Now in this, I told you esophagus will be like this. In front of esophagus will be trachea. Okay? So trachea is here, esophagus is here. Esophagus is here. Superior vena cava, inferior vena cava. Okay, this is about the right lung. Now in left lung, impressions here will be, in this you have pulmonary artery in the center, above it will be the hip arterial, below will be the hip, right? Same here, pulmonary artery is here, but above it is not bronchus, okay? Bronchus is not above it, just see, bronchus is below the artery, okay? So bronchus is here, feel it. Trachea, see the bronchus is like cartilage, this is thick. So you will see pulmonary artery above, bronchus below, then in front will be the superior pulmonary vein, inferior pulmonary vein. Okay, so left is here, huh? Pulmonary artery, bronchus, superior pulmonary vein, inferior pulmonary vein. Okay, then in this, yes, first will be the left ventricle. Above it will be the ascending aorta, then arch of aorta, then descending aorta. Okay, then in front of descending aorta you should remember esophagus is here. This impression, yes, this impression is for esophagus, because in front of the aorta, esophagus in the lower part turns to the left, otherwise it's on the right side. Then in this same you have first rib here, then trachea here. Okay, clear? So trachea will be here, because this trachea and esophagus. Yes? Yes, this is lingula. Okay, lingula. You should remember it, we keep it.
And the cardiac notch.
Yes, this is cardiac notch. We can keep it like this. What is the structure? You write lingula. Okay?
The ligament from the inferior.
Yes, pulmonary ligament you mean. Pulmonary ligament is present here. In some of the lungs it's better. It's present from this, it's here like this. So if you find any white like this, you can see this? Yes. It should be plural. Very important. We can ask you, we can put it here, what is the structure related to this? So you have to say. Because we ask you, because we want to make sure you know which